This is a short discussion on perirectal abscesses in horses. This is not a common problem, but when we see them most commonly in young horses and in brood mares. There's a chain of 10 to 30 lymph nodes that sit dorsal to the rectum in all horses, and these can become inflamed and abscessed. In brood mares, perirectal abscesses are usually secondary to vaginal trauma, such as from pipette injuries or foaling. The wound occurs and then seals over, trapping bacteria inside. Before we talk about it, I want you to think through what you might expect to see in these animals. If a horse has perirectal abscesses, would you expect a bright, alert, and responsive animal, or do you think he might be a little bit off? What about TPR? Any fever, elevated heart rate, or respiratory rate? Do you think you could see anything on external physical exam? What about if you did a rectal? Do you think an abscess lymph node in that area might have an effect on manure production? Could it potentially affect urine production? The most common signs we see with these problems generally result in low-grade colic. The horses are usually off feed, quiet, not feeling quite so well, and you do usually have a fever. Fecal production is often decreased because it actually hurts them to defecate. So they have pain on defecation and straining to defecate because this mass is in the way. If it's big enough or positioned properly, they may have problems urinating as well. And if you were to do a rectal examination, you should be able to feel a fairly large rounded mass per rectum. So then to confirm your diagnosis, what would you do? You think you've got an abscess? How are you going to figure that out? So you're right, CBC should show us signs of infection and inflammation, so that can be confirmatory. And then we're usually going to try to get a sample of the mass to make sure it's not some other structure, such as a hematoma, seroma, or even a tumor. We usually do this with ultrasound guidance. The most common route would be to stick the ultrasound probe in the rectum and then stick your needle in beside the rectum to try to triangulate into the mass using the ultrasound to show you where your needle is at. Then we can get a good aspirate or even a true cut biopsy if we need to. So now we've confirmed that that's pus in there. What are you going to do about it? What's the main treatment option for most abscesses? This is a fairly small abscess sitting dorsal to the udder. It says abscess supramammary lymph nodes. Antibiotics probably aren't going to do us a whole lot of good because they're not going to penetrate very well, and then they'll just get flooded out by the large amount of pus. So the best thing for most abscesses, whether they're big or little, is drainage. And that's what we need to do for this perirectal abscess as well. So usually using epidural anesthesia, probably some sedation, we're going to create drainage of the abscess into a safe area. If this was a mare, we could drain it into the vagina. We could drain it into the rectum. Probably most commonly we're going to drain it the same way we aspirated it, letting it drain lateral to the anus. So we're going to incise through the perianal skin and dissect forward until we hit the abscess and let it drain back out that tract. And then we'll flush that tract daily until it basically heals from the inside out. Usually take close to a week. These things actually respond very well. They don't usually recur, and after you get the abscess drained, you have a fairly happy, healthy little horse again.